now until May 30th. So we are working here at the city to continue to provide services. Our police and fire departments have not been reduced. They are in full force. Some of the other departments are working a little differently to create social distancing, but we are continuing to provide services for the community. We have an action plan that we posted on our website, which is citykankakee-il.gov. On the upper left side of the home page is a coronavirus tab, and there's also a tab for public service announcements. So you can find information, anything related to coronavirus 19 on the home page at that site on the tab. You can also access our plan in both English and Spanish. And starting tomorrow on May 1st, anyone who is over the age of 2 years and can tolerate a face covering is being required to wear that covering. And specifically, if you are going into a public space and you cannot maintain 6 feet of social distance. So we've had a lot of concerns about shopping in grocery stores in particularly, and other places where people are not able to maintain or haven't been maintaining the 6 feet of social distance. So under the new order that starts May 1st, the governor is requiring us to have a face covering if we're not able to maintain social distancing in whatever spaces we go into publicly. That is one of the modifications of his order. Our police department, like I said, is going to continue to work with the community. They are, fully staffed. We haven't reduced the staff. I want you all to know this is not a situation where I want people to feel like they are being harassed or targeted or anything like that from the police. I am asking people to cooperate and work with the community. Our community has done a good job for the most part. I've been receiving a lot of emails about the sheltering in place, but I stated at the beginning of this process that we, of course, are going to comply with Governor Pritzker's executive order. So I want to thank you all for your cooperation. The police, again, will be working with our residents and business owners. They are in charge of enforcement, so if there are any issues that you are aware of, you can contact them on the non-emergency number, which is 815-933-3321. River Valley Metro has also released an update for buses. They are requiring all passengers to wear a face covering. It does not have to be a medical mask or a medical grade mask, but some type of covering on the nose and mouth. If you do not have one, they will not allow you on the buses. We shared a video today on how to make a mask or a face covering out of something that you already own, a t-shirt. And you do not have to know how to sew, which is good because I'm not a person that sews. So I'm going to check that video out at some point as well. And they have more video tutorials available on YouTube. So we're just doing everything we can to share resources with the community. Governor has advised that he has secured more PPE, which is personal protective equipment. That is coming to our state, and they are going to distribute that based on the highest need and priority. Someone called the office a couple of days ago asking if the city was able to hand out masks to all the residents, and we do not have capacity to do that. However, there is a mask drive that's going to be held for senior citizens 60 years and older. And we posted on our website and social media those locations. The mask drive will be held tomorrow from 10 a.m. until 2 p.m. and then again on Monday from May 4th from 10 a.m. to 2 p.m. And those drives are located at various locations throughout the city. And so I encourage you to go to our website or to our social media platforms, Facebook, Twitter, Instagram, and LinkedIn for that information. I just want to encourage everyone. I know this is a very challenging time. None of us have ever had to deal with a situation like this before. We've had a lot of rain this week, but we anticipate the weather's going to be getting nicer, and it's very challenging. So I just want to encourage you all to remember that we're doing this to keep each other safe. On a positive note, our seniors, our graduating seniors, I want to congratulate the class of 2020 And we started an initiative here at the city called Love My City, Love My Grad. I talked about Love My City last year. This was an initiative I worked on at the National League of Cities. All of us came together at one of the conferences to talk about how we can promote our communities and really foster the love of community, particularly during such a hostile time in our political world. And so out of that was born Love My City. And I brought that back here to the city of Kankakee, and you'll see different initiatives that we start, and we include that whole Love My City theme in those particular events. So because our seniors who would normally be graduating from high school, having parties and ceremonies and different things, trunk parties, are not able to do those things, we here at the city wanted to come up with some type of initiative to recognize and honor our seniors. So we have Love My City, Love My Grad, and I want to give a shout out to Jasmine Humble, who's our marketing and communications coordinator. She came up with the artwork and the framework, and we are asking seniors to submit their pictures either through email at lovemygrad at citykankakee, just 2 words, -il.gov, or you can go to our website and submit your pictures. We know a lot of people like to take pictures downtown in the city, at the depot. We have murals throughout the city. So if you have pictures, especially if you've taken them in the city of Kankakee, we want you to send those in. And these are this is available for graduates from Kankakee High School, Bishop McNamara Catholic High School, and also Kankakee Trinity Academy. We are very proud of you. And when we can all celebrate and be together in a safe way, we are going to do that. So congratulations to the class of 2020. We hope you participate in Love My Grad, and we hope you all will follow us on our social media platforms. Moving to the census, while we are dealing with the pandemic, it is important now more than ever. So in the big scheme of things, when we have businesses that are closed down, the city is losing sales tax revenue. We have places that have gaming. We're losing gaming revenue. We have business owners that are losing revenue. So this has a big impact on a lot of people across the city. And so one of the things that we are required to do by law in our U.S. Constitution is count our population, and that's the census, and it happens every 10 years. And so we are in the year where we need to be counting our population. When I checked a couple days ago, we were under the state average in terms of our response rate. And it's really important now, especially when we're losing revenue and the federal government is creating packages to assist residents and business owners and municipalities, that we have an accurate count of who is actually in our state and who is actually in this municipality, the city of Kankakee. One of the things that I'm very proud of, I'm glad to announce, when I attended the conference in March for National League of Cities, they, of course, have been pushing the census and the importance of the census because it affects the federal dollars that come to municipalities, the state and the local government entities. It also affects the representation that we have, who's raising our voice, the city of Kankakee, and our interests in Congress, in our Senate, and in the U.S. House. So they announced to us in March they had secured $1.6 million for grant funding, and I applied for a grant while I was there. I want to thank my comptroller, Elizabeth Kubel. I was bugging her very late that night to get this grant submitted, and we found out this week that we received $10,000 for our census efforts, so I'm really excited about that. I'm planning to use this money to further promote our 2020 census. We did get another grant through the state that's under our Economic and Community Development Agency, and so I'm working closely with Barbie and her team in terms of how we strategize and utilize our resources for census. But we know we have some harder to count populations and areas in our city where people tend to not report. And so we want to use this funding to, again, promote the census, assist with those hard-to-count areas and populations, and incentivize participation. I would like to hire 2 interns between the ages of 16 to 24. That's my Kankakee United age demographic that we are looking to work with. And I want them to help me come up with activities and ways we can incentivize youth participating in the census. We do encourage you to self-report. A form was mailed to all households the middle of March, so you can fill out a hard form that came to your house, or you can self-report by mailing the form back in, phone, or online at www.2020census.gov. We don't want people to come to your house. They've extended the census until the fall, and so hopefully we won't be sheltering in place. And so we don't really want people to have to come out to your home. We want people to self-report. So if you have not completed your form or phoned in or completed it online, I'm asking you to do so. Ricky Rockets. This is more good news for the city of Kankakee. So when I became the mayor, this project had pretty much died, and I've been working on this for 3 years. And I think that every place that I have went in the city, someone has expressed concerns about the east side of Kankakee. I remember talking with Addie Burrell, who lives in the 7th Ward, which is on the east side, Marycrest. I know Kevin Mitchell has, tuned in to some of the live streams, and he's asked about Ricky Rockets. And so, people from all over the community have been concerned. Exit 312 is our entryway into our city. And there's probably about 70,000 cars that travel on I-57 every day going past that interchange. And so, as you all know, the old Kmart building has been torn down, and that area has not been developed. So I have worked closely with our attorneys, some of the Capitol team members, and we were able to draft a new development agreement. The previous agreement under the last administration would have had us sharing a lot of our tax revenue for 20 years, and we were able to renegotiate an agreement. So we are not going to be splitting sales tax or gaming. We keep all of those revenues. We are transferring some money from TIF 8 out at Exit 308, where the Hilton is located, and we are going to refinance current debt that we already have for a lower interest rate and pay back that TIF. So we had a unanimous vote, 14-0, to approve the development agreement, and we are underway to start this project. As you all know, I want to mention my sister that I lost a month ago, Ursi. This was something that we grew up on the east side over in Hobby Heights, and I felt really good about getting this done because she and I had been talking about this over the last 3 years, and she really wanted to see this project come to fruition. So I want to say congratulations to the city of Kankakee. Thank the city council. My department heads we put in a lot of work, especially the last week up until the council meeting, late nights, weekends, just getting everything together. And thank the community for being honest and for engaging and giving feedback and expressing their concerns. A lot of people have been frustrated, understandably so, but it was worth the wait. So we are going to, we're looking at a $10 million project, $10 to $12 million. We established this TIF on the east side of Kankakee, the East Court TIF, I believe in February. We've already secured a $10 million project in April. It will be built in a year. Engineering will start very quickly, probably next month, I believe. And we hope to have a shovel. We should have a shovel in the ground late summer, early fall. And this should be built within a year, so that TIF will already be generating increment. So I'm really excited about this. Again, it'll be right off Exit 312 at Court Street, and it's going to include a Ricky Rockets fuel center, a car wash, a convenience store, and a fast food restaurant at minimum. So we know this is going to create not only construction jobs, but some other jobs, and it will present an opportunity for further expansion as well. So again, thank you to all of you who helped make this happen. I think I have a question. Okay. April is also volunteer month, so we, during the month of March, I honor women, phenomenal women, and this month I wanted to honor exemplary men, and then we had a pandemic. So what we did is posted everybody's photo with their favorite quote on social media, and I just want to thank everyone who volunteers in our community. We need people that are going to be problem solvers and workers. Everybody can complain. It's easy to do that, but I really appreciate people who step up to do something about our challenges. So I just want to say those men's names: Phil Hodak, Dr. Willie Davis, Victor Navarez, Scott Snavely, Anthony Grant, Matt Heading Hess, and Alonzo Cephas. Congratulations to you, our 7 volunteers for this month, and thank you for all you do for the community. ECDA, our Economic and Community Development Agency, has put out a survey. We've been hearing from our residents about the new development on the east side of town, and we want to know what further development or initiatives would you like to see in the neighborhoods and in the city. It's really important to me that we engage the community. We need to do a better job of hearing from our community, and so I'm asking you to participate by going on the website and providing your feedback in our Kankakee Economic and Community Development Agency survey. Yard waste was an issue that came up. Republic Services had suspended services due to COVID-19. However, they announced that they will be, they have reinstated pickup for yard waste. They are asking that we help them by leaving containers open so that they can identify that it's yard waste. So that service has been reinstated. No stickers are needed at this time. As we move on to our guest, I just get ready for our guest. I just want to give a quick update about coronavirus 19. I want to make sure that you all are following our social media sites and our website. Again, we post updates every day, several throughout the day. I'm asking that you all share those as well so that we can get information out to the community. Whether you are a business owner, you need emergency child care, or you like to know how to get tested, we are providing that information on the website and on our social media platforms. I've also been doing a daily video update Monday through Friday, and I hope those are helpful. I provide data in terms of where we are with our numbers for confirmed cases, both in the county and state level, and I provide information that we're sharing for resources. So as of today, the Department of Public Health has indicated that we are at 52,918 confirmed cases of COVID-19 in the state of Illinois. We have had 2,355 deaths. At the county level, Kankakee County, the health department has confirmed 383 cases of COVID-19 with 28 deaths and 99 recoveries. So I want to extend condolences to the families who have lost loved ones to COVID-19. And it's very hard, of course, to lose a loved one, but to not to be able to visit them in the hospital when they're sick places a bigger challenge and burden on families. So we want to extend condolences to you at this time. I want to make sure that the updates are helpful. I'm not trying to cause panic, but I want to make sure that I'm talking to you regularly and that I keep you informed with accurate information. So one of the great things that has happened over the past couple of weeks is that we now have a site in the city of Kankakee for local testing at Aunt Martha's, and that leads us to our interview tonight with the Senior Vice President of Community Integration, Mr. Kenny Martin Ocasio. And Kenny, I want to thank you for joining us. Welcome.
Thank you for having me. Absolutely.
Kenny, can you tell us, you're the Vice President of Community Integration. What does that mean? What is that all about?
So it's a big title, right?
It's a big title.
And it really affords me the great opportunity to work far north as Rockford and as far south east as Danville. And it allows me the opportunity to work with all of those communities and making sure that we are really engaging the folks and really understanding how to best serve those communities by engaging them, by making sure that we are engaged with them.
It's very
Really collaborating, making sure that we can elevate what we're doing to even better work.
okay. So my first question, there are 6 locations throughout the state, correct?
Correct.
Okay.
And they are in, of course, Kankakee is one of them. We have one in Danville. We have one in Chicago Heights, Harvey, Joliet, and one in the south side of the city at our integrated care center.
Okay. How did they determine the locations? How were the locations selected? We are in a huge state of, Illinois is pretty big. So how were those sites picked?
Sure. So, in looking at the partnership that we wanted to establish with the Department of Public Health, we also wanted to complement a lot of what they were already doing, one, and two, being cognizant of the fact that there were other federal qualified health center networks in the mix, also opening up their clinics and offering sites. So we wanted to, within our network of 24 centers throughout the state, look at where are some of these areas where we knew there was going to be necessarily a testing site, and where we knew we wanted to make sure that those communities were going to be represented and tested, and making sure that there was access to that. So of course, Kankakee had to be one of them.
Okay. I think one of the big questions that our audience has is testing free? That's something that I hear about all the time. People are asking about testing and if it's free.
So it is processed through the health insurance, but as I understand, part of the CARES Provision Act, part of the CARES Act, one of the provisions is that no one is going to be in fact charged for this, because part of what is any barrier possible to discouraging people from pursuing the test, and cost is one of them. So we will go through the insurance process, but at the end of the day, no one should be charged.
Okay, I'm looking. Okay, can you give us an update on the criteria to be tested?
So that's very important, because up until last week, we had, again, in collaboration with the Illinois Department of Public Health, going with folks that were experiencing symptoms of fever and cough and shortness of breath. And in addition to that, we were also wanting to make sure that folks that have been exposed to it through caring for others, and folks that were working in the front lines were tested. Now the testing or the symptoms list has increased. We have folks that may experience chills or repeated shaking as a result of those chills, or some muscle ache, or they may experience sore throat, something that some folks may not have expected, maybe the sense of losing their taste or the smell. So all of that now is compounded with that. But again, part of the testing group that we want to make sure that gets tested is folks that are at the front lines, not only as first responders, but folks that are really contributing to all the things that you were describing on an everyday life, like folks that have to go to work at a grocery store, at a pharmacy, at a gas station. Folks that really contribute to everything that happens on a daily basis really should be tested, because they are exposed to everybody, right, that they're serving. So we want to make sure that they're tested, of course, in addition to first responders and anyone else who is experiencing symptoms. We also want to make sure that folks that are experiencing homelessness and are going into congregate sites are also testing, because especially when you're in congregate care, that is a space where, spread can happen rapidly. So I think what it does, Mayor, is that it opens up the doors to a whole lot of folks that before that may have thought, well, I don't belong into that category, I don't check that box, I don't have the symptoms, so I guess I'm not going to. Now we're saying, you know what, you may actually have been exposed and not know it. It's better to call and ask and get screened just to make sure, and more likely than not, we will tell you come.
Okay. And people need to call before they come for the test. It's drive-through testing, correct?
It is a drive-through testing. They should call, and this is what is actually happening. This is one of the things things that was happening even on the first day when we opened in Kankakee was that folks did not know necessarily that we were up and running tests, and they were coming up. Of course, once the sign says it's by appointment only, and they would say, well, I don't have one, and I would tell them, well, here, there's this packet of instruction that I'm giving you right here. Call right now, get your phone screen, which lasts up to 10 minutes at the most, and you can get a slot right now. And they would do that. They would get screen on the phone, finish with that, and come back into the line and get a screen on that day. And because we have a lot of slots open, even now today. So it is a very easy process, even with the appointment only. We do that because we want to make sure that they're speaking with a provider on the line and going through those sort of questions. But at the end of the day, it's a matter of making sure that we're giving everyone access and the ability to pursue that.
Okay. Let's talk about the test. I've heard rumors. What does the test consist of? What is it like?
So right now, it's without getting into like the whole technical term, it's really about a swabbing of the mucus inside your nasal cavities to detect what is the bacteria that is there, what is the actual composition of that, and that's what it actually gets tested.
Okay, so you're gonna, so it's like a Q-tip.
Exactly, it is, yes.
Okay.
And that is what it gets. The sample of that gets immediately contained into a kit and shipped to the lab.
Okay. Okay. How soon can people expect to get results?
We are getting the results, and again, I think a lot of this may be because of volume. If volume were to increase, it may be more than 48 hours. Right now, we are getting them within 48 hours, and so at the very most, within 72, they will receive a call from the provider with whatever the result is. They'll receive that call, yes.
So 48 to 72 hours?
Right, correct.
Okay.
One of the things that we do is, as soon as they get tested, we give them this pamphlet of information so they know, okay, so what do I do now that I have gotten tested? Well, there are some steps here to follow beyond even some of the things that you mentioned around social distancing and washing hands. If you can at all, really engage in self-isolation for at least until you get the test results, because you don't know. You really don't know if you are, in fact, actively carrying the virus with you. The best way of controlling the spread is just stay away until you have verified that you are symptom or virus-free. Rather, stay away, self-isolate to the best of your ability. And so there's a whole host of information on steps to follow. And I want to make the point, because I know this is important to you too. It's in English and in Spanish. So all of that information with steps, with things to look for, like what if I get worse, or what if this happens? My shortness of breath gets a little more acute, or I have perhaps some chest pain or wheezing. All of those things we talk about what to do when that happens and to what extent. And just like you said, like you were asking, like what to do after you're tested. We want to make sure that folks understand. So what is the process now to wait until I get my results?
You mentioned something when you were giving your explanation about not showing symptoms, and we refer to that as being asymptomatic. So you can
Correct.
Not be showing symptoms, but still be carrying the virus and pass the virus on to other people. So if you are not showing symptoms and you think you may have been exposed or put at risk, what would you recommend?
Call immediately, because you will more likely than not will get tested.
Okay.
And that is, I so appreciate you saying that, because that happens with many airborne viruses, in which people may not necessarily show the symptoms, and because of that, they may not think, well, they may think I'm not a part of that, right?
Right.
No, that is not true. You could be very much an active carrier of it, and be as a result of that exposing your family, friends, your coworkers, folks, in the street. So it is best that you pursue the testing. Yes.
And that's one of the reasons they're encouraging the face covering, because if I'm a carrier and I don't know it, I want to protect what's coming out of me so that I don't expose somebody else to it.
And that is all we have, Mayor, is behaviors. That's all we have right now. We don't have a vaccine to prevent us from getting it. We don't have the medication to treat it if we get it. We have the test and to confirm whether we have it or not. And then we have behaviors like social distancing, like putting on a mask, like washing our hands thoroughly, like using hand sanitizer, like avoiding crowds. All of those things are things that are pretty much within our control to do.
Correct.
And so those are the only sort of prescriptions that we have at the moment to help prevent the spread.
Someone submitted a question and asked, what steps do you follow? And you kind of talked about that. You all provide a pamphlet that gives some instructions. You encourage people to stay away, to isolate until they get the results of the test back.
At the very least, yes. If the symptoms, and again, the pamphlet does give you that specific list of symptoms, that if you begin having other symptoms and they get worse, that's when you then need to be calling us back and say, hey, I'm getting worse, I'm not getting any better. This is, whatever I was experiencing when I went to get tested is actually getting worse. Call us and we'll then give you some direction. But yeah, it's all included in this set of pamphlet, yes, in this information packet.
Okay.
And, part of this is also that, again, this is not only for our patients, this is for anybody in the community who needs it. And one of the things that we find is there's a whole lot of folks, especially in Kankakee, that are not necessarily attached to a primary care medical home.
Right.
They don't go to the doctor regularly. They don't have a relationship with a physician with whom they can talk about these things. And they may only consume health care by going to the emergency room when things get really rough. And what we're saying is, even if you don't have a primary care medical home, come to us, go through this process. You may want to choose us as that, but at the very least, get tested.
Kenny, what's the phone number that people need to call in order to make an appointment to come see you?
So it is everywhere in all of our material. It's 877-692-8686.
Okay. And I'll repeat that, 877-692-8686.
And also, Mayor, our website, of course, andmarthas.org, has just a wealth of information on the coronavirus. It is something that, websites didn't get updated as often as they do now. It's amazing. Webmasters are really hard at work trying to put up information that is constantly changing, as you were describing, because symptoms are changing, guidelines are changing, and information is just getting to us every other hour. And so we want to make sure that we're updating it. And we have a very resourceful website with a whole lot of material, not only about our testing sites, but about all of these other symptoms and ways to help prevent it too.
Right. It is a task because it's a novel coronavirus, one that we haven't ever been experiencing, and globally, across the world. And so as we learn more about it, you're right, information changes every day. And that was one of the things I hope that I drove through to the community was that, as we get information, we're going to keep sending that information out to you. But because we're learning every day, that information changes. For example, the symptoms that you mentioned, we now are seeing a trend with some additional symptoms like the loss of smell and the loss of taste. That wasn't a symptom of this when we became aware that this virus was in our country. So it is a challenge, and
that happened last week, like over the weekend. Right. So yeah.
Right. How has our response been so far in Kankakee?
So, we still have capacity for more. So I want to stress the fact that when we actually were sort of timing it and assessing within our workflow, how many can we actually handle? We can process, 3 times as much as we're doing right now. We've done about over 50. We could easily do 500 in a week if people were actually calling in, or in a couple of weeks, I shouldn't say in a week, because, we're only in Kankakee for 2 days, but we can definitely do up to 40 a day if the need is there. So again, we're encouraging people to Call if you can on the same day, make sure. And we're giving same-day appointments more often than not. So the accessibility is there, the availability is there. So we just want to make sure that your community is aware of it and partakes in it. Because, again, as I said, it's all we have right now.
What can we help you do to get the word out? What can the city of Kankakee do?
This forum is most helpful. Your staff, Jasmine, has been great in posting things on the website, and she and I have been in communication every other day about the things that are happening. I think you're doing great in being in front of a lot of things as well, because as you know, IPH is posting information on a daily basis also that is germane to the county and to the city. So let's continue having these conversations. Let's continue talking about the impact that it's having, because it is a medical issue that is having social, economic impacts on all of us, not only in physical health, but in emotional and mental well-being as well.
Yes.
And we need to continue talking about it and making sure that people don't take for granted the way that they feel that if they're healthy, they don't have it. Again, we don't know anything. We don't know it until we get tested and it's ruled out.
And I spoke with Phil Cambick yesterday from Riverside Healthcare. He's the president and CEO. Most people in the community know Phil. And he wanted me to mention, I was on the radio this week as well, so I did talk about this on the radio, just trying to use another platform to get this information out to the community. But Phil also stated that there have been a number of people who have been scared to come to the emergency room. And so by the time they get to the emergency room with the symptoms, particularly around respiratory symptoms, they have waited almost too late. And we've lost some people that way. So he just wanted me to mention, and Amita St. Mary's as well. I've spoken with Chris Schreit, their president and CEO. They have both hospitals, Amita St. Mary's and Riverside, have taken precautionary measures to keep people safe when they come into the hospital. So if people are afraid because of being exposed to other patients and that sort of thing, those measures have been taken. And if you need care, we want to make sure that people get the care they need. We are fortunate to have 2 hospitals in a town our size. And so I just want to make sure that I mention that. I told Phil and Chris that I would.
That's very important, because people may be discouraged or just apprehensive about accessing healthcare because of exposing themselves to folks that are sick. Mm-hmm. And we too at our health center have taken measures to make sure that we are spacing folks far apart, that we are taking people with enough spacing, that we have barriers and protective equipment and for all the staff. So yeah, it is a new way of delivering healthcare and a new way oftentimes of consuming many other services. And so we want to make sure that people know that, yeah, we are all taking all precautionary measures to make sure that their ability to access healthcare doesn't change.
That's a good segue to my next question, to discuss patients and staff safety at Aunt Martha's when people come in to see you. What is your protocol that has been put in place when people come in?
So one of the things that we do is that we have curbside, if you will, service. So one of the things that we have is a sign on the front door that says, if you're actually coming because you have these symptoms, stop, go back to your car and call us at this number, and we will check you in through this process. And when we're ready for you, we'll tell you then to come in out of your car and service you. If you're coming by bus, we'll tell you to wait out in the first lobby area. And again, we have all of these spacing, and we have really sort of retrofitted and redesigned the layout of the waiting room to make sure that folks are maintaining that social distancing while waiting to be actually called in. And again, all of our staff is wearing what is now called PPE, personal protective equipment, to make sure that they're protecting themselves and the people that for whom they care.
Okay. I think I saw a question. Marie says, are you giving blood tests too?
Marie, this is not a test that requires that. It is airborne. So for now, the method that we're using, that it's used pretty much worldwide, as we're saying, which is the swabbing, is the most acceptable and reliable test that there is, and it gives the results that we are looking for. So it isn't something that I think at this point requires blood tests. No.
Okay. And then someone asked about a finger test. I've never heard of that.
I haven't either, so I'm not going to respond.
Okay, maybe she meant, can you do it through the finger or something? I think people are really nervous about the Q-tip swab. People are very nervous about having that inserted in their nose.
I can understand that. Yeah, I can understand that. And, you know, it's uncomfortable, it's invasive, but it is quick. And ultimately, I think the peace of mind that you receive, having gone through it, with whatever the result is that you have now information that you did not have before the test. Mm-hmm. And I think that hopefully overcomes any discomfort that you may feel from it.
Okay. How long have you been working in this type of, in community health?
So I've had the privilege of working for Martha's now for 4.5 years. And it's a great organization. You know, beyond healthcare, we also have child welfare. And we also have a vast array of community wellness services, like support housing, like workforce development, juvenile justice and crisis intervention, and substance abuse and parent support. So we have really a whole, and actually in Kankakee too, we have a lot of these services in Kankakee. One of them is the Illinois Welcoming Center for newly arrived folks from other countries. And part of that service, which is funded through the Department of Human Services, is that it really helps folks that are coming in to navigate. We help them navigate through the systems, be it the school, the healthcare system, you know, the utilities, the government, all of those things that are new and foreign, of course, to them. We are tasked to do that for them, especially, you know, when you were talking about the census, the necessity and the really importance of making sure that everybody is counted. We want to make sure that nobody is not counted. So that's one of the many services that we have. So yeah, I've had the privilege of working at Martha's now. And, you know, this is one thing that no one expected, of course, but we are tackling it head on.
Okay. And you made me think of something when you said people coming in from other countries. In terms of the census, there is not a citizenship question on the census. That is something that was also deterring some people from reporting, but that question is not on the census. So I just want to clarify that for the community. Kat has a question, and she asked, what if COVID-19 data is not accurate and people are saying what the numbers are? What's your input on this?
So that's a fair question. And I would say this is a pandemic that has been and is being constantly, as you mentioned, studied, researched, explored, looked at by so many different bodies, not only by the NIH and by the CDC and by DPH, but by so many entities that right now what we have doesn't really lead us to believe that there's any inconsistency or unreliability in the data that we have. It is the best data that we have, and with that we have to then act on it and say, okay, then this is the best method of preventing it, this is the best method of testing it, and so I would say the data that we have is reliable enough for us to proceed on it.
And that's one of the things that I talk about with the community regularly, is that they look at reliable sources. So I'm getting data from, at the local level, from both of our hospitals and the Kankakee County Health Department. At the state level, the Illinois Department of Public Health. And then I'm also participating in the Bloomberg initiative. He has a city initiative for mayors, and he's working with Johns Hopkins University and Harvard. And so I've shared that with the community so that they know when I'm giving them numbers and updates, this is where I'm getting the data from. I am trusting science and research so that we can make informed decisions. We know that we don't know everything about this. Like we talked about earlier, it's, we're finding out and learning different things every day. But those are the sources that I'm going to get my information that I'm sharing with the community. And I'm, advising the community, recommending that they do the same. Trust those sources. The CDC, the Centers for Disease Control. You mentioned NIH, which is the National Institute for Health. Those are scientific resources that we have, and that's who we're leaning on right now, our scientific community, medical, public health community to help us navigate through this pandemic. Belinda says, better days are coming, praying. Yes, I am a praying mayor, and I am praying for our community, our global community. Patricia says that can Kenny talk about the services rendered throughout the Welcome Center, such as helping people apply for services?
Sure. Again, the Illinois Welcoming Center primarily driven or primarily geared to serve new immigrants coming in is really about making sure that people are connected. Do they know where the schools are, where the supermarkets are, where they can apply for an apartment, or where they can apply for healthcare if they're eligible, where they can access a job listing, things like that, to make sure that they're immediately connected, that they are not engaging in isolation themselves, and that they really become active participants of the fabric of the city and of the neighborhood and the community, and begin really participating and contributing to the development of the community as well.
So the things that you touched on, I'm a social worker. I don't know if you knew that, but you talked about basic needs, shelter, yes, food, a means to earn a living, those types of things, and those things are important. Lily asked, how many cases are there in Kankakee? So Lily, I already gave the numbers today. The numbers are not broken down by the city, they're broken down by county. So in the county of Kankakee, our health department has confirmed 383 cases. The Kankakee County Health Department is the entity that tracks all the data related to public health issues like COVID-19. So they have not broken it down according to city, but county, 383 cases. We've had 28 deaths in our county, and we've also had 99 recoveries in Kankakee County. So hopefully that helps, Miss Lily. Sherry says, glad they are testing at Aunt Martha's. This is great information, Kenny. Again, I told you, people really appreciate being able to hear from our experts and our community leaders to learn more about what's going on. So
it's good to know they're engaged. Yeah, absolutely. Yeah.
Kat says, testing is a person's choice and is not mandated by law. That is correct.
That is correct, yeah.
That is correct.
That is correct.
Let's see here. And you mentioned some of the other services that you have. I used to work at Aunt Martha's years ago. Substance abuse, with adolescents. Wow.
You're taking me back to my years of mental health and substance abuse with adolescents 20 plus years ago.
Yeah, me too. Yeah. A long time ago. You all actually,
plus years ago, yeah.
You had a site on North Schuyler, 300 block of North Schuyler. So, yeah. So I actually worked there.
We have been in the community for decades now, actually. Yeah.
Yeah. I'm trying to think, is there anything else you would like to add?
I think, again, it is to what you were describing earlier about the adjustments that we've had to make to really be able to continue living our lives through this. Graduations being impacted, people's livelihood being impacted, people's ability to access many services, and just to live life normally being impacted. And as a result of that, their mental health being impacted. All of that is, of course, unexpected. It is part of what we do and part of what our work really, what drives our work. For now, it's, again, all we have available to us is a test. We don't know if next week or in 2 weeks from now we'll be able to say, oh, look, they came up with a vaccine or a treatment. We don't know that.
Right.
Because as you said, the science is what we have, and we are looking and monitoring and observing how it continues to feed us more information, and more efforts are being made to really understand what this is about. So in the meantime, in order to live as a community and to thrive as a community, is participating with as much responsibility as a community. And that's what this testing campaign is really about, to make sure that everyone takes advantage of it and not only understands it as taking care of themselves, but of those that they love and with whom they interact and live. So I want to thank you for the opportunity again, and I really want us to be able to together go through this.
Yeah. I've had several emails come in about churches asking me to make them essential. And I just want to, provide some education around that. As the mayor of the city of Kankakee, I did not determine what businesses or entities are essential and non-essential. That is determined by the governor of the state. So I do not have the ability or the authority to do that. And so I don't know who these people that are reaching out to me, they're not giving me an address. I don't know if they're Kankakee residents or not, but I would recommend that you contact the governor, because that's who made the decision on who's considered an essential business versus non-essential. And with that being said, we are the county seat. Kankakee, the city is the county seat, the city of Kankakee. And we have a lot of people who are very interested in what's going on in the city of Kankakee. So with that being said, is testing available to people who do not live in the city of Kankakee?
Testing is available to everyone.
Okay, very good.
Testing is available. If they're driving down 57 from one or one county to the other, and they want to get tested, they can
get tested.
Get off on Court Street and right there get tested. Yes.
Okay, very good. I wanted to make sure that we let the regional community know for sure that it's available.
Yes.
Where can people go, Kenny, if they want to get more information?
Again, our website, I think we have been able to pack it every day with great and new information, and marthas.org. I think that's the best place to start. And from there, you can actually look and understand what we're really trying to capture with this testing campaign, and hopefully make the call and get screened so you can make an appointment and come and get tested.
Okay. Kat says...
But even the resources that you mentioned, Mayor, the county, your county, has a website, and IDPH and CDC, all those are... We look at those every day,
Yep.
Beyond looking at the governor's briefing. We're looking at all that data every day.
Yep, absolutely. Kat says, is it mandated to wear a mask? If so, what happens if people don't wear them? So effective May 1st, Kat, yes, it is mandatory to wear a face covering. It does not have to be a medical mask. You're mandated to wear, if you're 2 years old or older, and you cannot maintain 6 feet of social distancing, you are mandated to wear a mask. So if I get in my car and I'm alone in my car and I drive to work to my office, I'm not mandated to wear a mask. But if I'm going to be in a store or, maybe in the post office, which I know they have tried to put the X's down too to keep people distant. But if I'm going to go somewhere, for example, an essential place like a grocery store, I'm using as an example, and I can't maintain 6 feet social distance, it's best to have, they're mandating a face covering. So I would encourage everyone to carry some type of face covering, because you may be going somewhere and think you can maintain the distance, and then you get there and something's going on and you can't. But again, we posted today on the website ways that people can make a mask without having to know how to sew. And you can make one out of a t-shirt, which we all have a t-shirt. Many people use bandanas. Some people, I was talking with some of my female mayors in my women's network. One of the mayors in Colorado said that the neck gaiters have become popular. They use those a lot in Colorado, of course, because of the skiing and the colder weather. And those are kind of like a large scarf, and you can pull it up behind your head, or you can pull it up this way to cover your nose and your mouth. It's really important that you cover both your nose and mouth, because if you are exposed to the virus, If your nose is uncovered, then you can breathe it in. And if your mouth is uncovered, some people pull it down or pull it up, then you can breathe it in. And this is passed through droplets, so you don't see it. And so this is just an effort to continue to decrease exposure. So what we've been trying to do in the state and across the country and actually globally is increase testing so that we know the prevalence of the virus in our communities, how many people have it, and also to reduce the exposure. And that's why effective May 1st, he's mandating facial covering. If you are not wearing facial coverings, if you go into a business, they can ask you to leave. So we did have a business owner that's already reached out to us and said, okay, what is our process? The River Valley Metro bus has also put out their press release that if you don't have a facial covering starting tomorrow on May 1st, you will not be allowed to ride the bus. So they can ask you to leave, and if you don't, then the police will be contacted, and they are going to ask you to comply or leave that business. So again, I do not want this to become a battle between the police, and nobody's trying to hurt anybody and infringe on people's rights. This is literally a life and death situation, and we are trying to keep people alive and healthy. And so I'm asking for people to cooperate, and we have overall had good compliance in the city of Kankakee. But we're doing this to try to keep people safe and healthy. Alonzo says, masks should stay up. That's correct. Marie says, thank you, Mayor and Kenny. God bless. Thank you as well, Marie. So I think that's all that I have. Kenny, do you have anything else?
No, again, thank you for the opportunity to come and share what we're doing and hopefully engage your community into the campaign. And thanks for the community for listening and for giving us feedback. We so appreciate it. And continue looking at our website. Again, beyond COVID-19, we have a whole array of services that we offer to the community of Kankakee. So please look at our website and what we have to offer, and looking forward to going through all of this together again.
Okay. This is Kenny Martin Ocasio, Senior Vice President of Community Integration at Aunt Martha's. We want to thank you. Marissa shared a video on how to make a mask, so we want to thank you, Marissa. I'm really interested in seeing this video because I am not a handy, crafty woman at all. But she said you can do it and not know how to sew. So I'm really excited to see this video. Again, I'm asking you all to make sure you stay informed. Follow our social media pages. Please, when we post, if you all can share, it helps get the word out in the community. The state COVID-19 hotline number is 800-889-3931. And you can get your questions answered 24/7 there. You can also visit www.coronavirus.illinois.gov for the most up-to-date information on COVID-19. I want to thank everybody for joining me tonight. Please continue to follow us. Please continue to share your questions and ideas that you may have to keep all of us safe. And Kenny, I'm sure I'll be over to see you soon. And again, thank you and your staff for everything that you're doing. Thank you for taking the time with us tonight.
Thank you.
All right. Take care. Be well.
You too.
Okay. Bye-bye.